Good evening, everyone. Welcome to today's webinar, Relief for Frozen Shoulder. Thank you for taking time to be with us. I am Ali from Nuffield Academy. We at Nuffield Academy delivers high-quality continuing professional education courses and content for dental surgeon and dental support staff. Today, we are partnering with Nuffield Wellness to bring you this webinar. Before we begin our webinar, there are a few points I would like to share. This webinar will be recorded, and if you like to record it with your family and friends, please visit Nuffield Academy YouTube channel. Free to post any question at any time in the Q&A option in the video section of your screen. Our speaker would do her best to answer all your questions at the end of the webinar. Our speaker, Dr. Varsha Santhosh, is qualified Ayurvedic physician from India's Pune University and has practiced in Singapore for 8 years. She strives to bring authentic Ayurveda to the masses. She has worked with many patients to relieve and treat ailments holistically. Without further ado, Dr. Varsha.
Thank you, Ali. Good evening, everyone. So before we begin our today's webinar, as usual, we invoke the strength, the power of the Lord of Ayurveda, Lord Dhanvantari. Om Shri Dhanvantaraye Namaha. May the words that flow out of this mouth be in accordance with Shastra and science. Today's topic, the frozen shoulder. Is it just a normal pain in shoulder? What is this particular thing? And we find that mostly probably a mother or grandmother has somewhere in some point suffered this, predominantly definitely seen in women. And somehow many people, they get better automatically, eventually after a few months or a year and a half or so. So without much delay, let's get into the topic. So this pain in shoulder, or whether unable to move the shoulder at all. So we'll see what Ayurveda has got to offer in this. But before understanding that, as always, we go the science way, because the gross is understood first easily, and then we go into the subtle aspect. Let's start first with what or why of this frozen shoulder. What and why? So what is this frozen shoulder? It's like pain and stiffness in shoulder joint, where a person suffers the pain, is unable to move the hand at all. The daily movements, maybe like combing a hair or just even while bathing, to wash the back. It's difficult for the person to do the daily chores. And many times, even the night is getting worse. Many times that the person is unable to sleep, because even if by mistake he turns the side, he or she turns the side, he is awakened by a sharp pain. So it's pain, a very bad pain. And it's also the stiffness of the shoulder joint, which immobilizes the person from all the daily chores. So this shoulder joint is like a ball and a socket joint. Our arm bone is ending with a ball kind of a feeling, and our shoulder blade, it has got some hollow like a socket. And the shoulder blade and this arm bone, the humerus and the scapula. So and also there is a collarbone involved in making of the shoulder joint, but this ball and socket joint. So what happens to protect this ball and socket joint, the shoulder, the head of the humerus or the arm bone that comes and ends up as a head, as a round ball, and the cavity of the shoulder blade. The shoulder blade is what we have at the back. When we just try to touch the back on the sides, not the spine, the shoulder blade, scapula is the other name for it. So this particular joint, when it is formed, it is nicely protected with good amount of a thick capsule. And this capsule is made up of connective tissue, and that capsule, that connective tissue, it begins to thicken and it tightens. So the movement of a ball and the socket, this freedom is gone and it stays over there as like a frozen shoulder. So a person cannot move the arm at all. So why this joint thickens, why this capsule thickens, why it tightens? So modern has not found any reason for it. And they also say that they don't know why such a thing would happen. It's not a wear and tear. It is the thickening of that capsule which holds this ball and socket joint. Okay. So because of this, the restriction of this movement, and because it is like a frozen, that connective tissue is thickened and it is tightening, this disease or this symptom or this condition is also called as a adhesive capsulitis. So which explains now what the disease is in a very clear way, that ball and socket joint, which has this capsule covering, it becomes tight, it becomes thick, and the freedom, the movement is lost. So it's adhesive. It just gets all jammed up and a person cannot move the shoulder at all. So this is the condition that we are looking into. And reason? Reason is the joint, the connective tissue thickens and tightens. That is the reason. But if you try to go into why does it thicken, there is no reason found out. It just happens. Okay. In which we are just seeing the modern angle. So they also prescribe very beautifully. Nice stages are given over here. Just give me a moment. Yeah. So in the beginning stage, what happens is this person, that any movement means he's able to move. The person is able to move the shoulder, but there is pain over there. And all movements are not easily possible. Maybe the reach was full, the reach is in a little lower angle, but still the movement is there. So this is like the beginning stage. So it is called as freezing. It's not completely frozen. It's going into that stage. So it's a freezing stage, it's a cell. So it can last just from a couple of weeks, few months, to 2 to 9 months it can last. Then comes the frozen state. So post 2 months to a year, it can last. In this, the pain may not be as bad, but the joint gets completely jammed up. It becomes so tight. It becomes that no movement is possible. The daily movements, we take the joint movement for granted. If you only realize it when it is not possible, then we understand the importance of a certain joint. And then the last stage is the thawing, where it automatically starts getting better many times by just doing few exercises, and not major anything is required. And the joint starts to get its mobility and slowly it improves. So the frozen shoulder goes through this stage and the person gets better. So it's nothing life-threatening. It is not a permanent condition. It comes and anyway, it gets solved from few months to a year or so, or maybe sometimes even 2 years. But definitely the person comes out of it. So now let's see what are the risk factors. The risk factors is little middle-aged people, above 40, they start getting it, and it's really very common in females. Then sometimes the immobility or the reduced mobility, like you're not using the shoulder joint, and that's why the capsule thickens. And you're not using the shoulder joint, probably you have injured it. There can be some fracture, or there are other muscles that support the shoulder joint. They are called, like, we are able to rotate, we are able to lift. So it's not off the joint, the capsules, where you see that capsule in one of the picture, you see it's a normal joint, and other you see how the connective tissue is getting damaged. But to support this particular, there are various muscles So they are called, the group of 4, they are called as a rotator cuff muscle. I've put one picture later. So there can be a tear of that, or there could be injury for that, or a person is having a stroke, or some surgery has done. So what in these 4 things, what has happened? That you are not moving the arm. So probably a frozen shoulder can occur. Okay. And then there are diseases like diabetes. So a diabetic frozen shoulder is the most commonly seen symptom condition in the clinic. And with Ayurveda treatments, we've done wonderful for these patients. And there could be other underlying diseases as well, like a hypothyroidism. There could be some Parkinson disease or some kind of a heart disease. So these are all risk factors, means these people are prone to get to the frozen shoulder. And what does the modern answer for this? Of course, you have pain, you take some painkillers, you attend a physiotherapy session, or worse come worse, then inject some steroidal injections. Or there's something, a system called as a hydrodilatation also, where water is injected in a certain way. Or under anesthesia, shoulder manipulation is done, or a surgery itself is done. So there are various, these are the options available in the modern science, and how it is treated classically. This is the way how all doctors would ideally go one by one and treat the frozen shoulder. Because we now saw how the situation is, what are the bones involved. The muscle can cover, but it is not the muscular tear at the joint, at the shoulder joint. It is the connective tissue, it is the capsule that is. So they would be dealing with that capsule. So when they do shoulder manipulation and all, it is all under done under anesthesia only. The person cannot take the pain of manipulation. Now let's come for today's topic, that we are how this condition Ayurveda is seen. So this is our main thing. So in Ayurveda, this condition is a similar to a we get a word in Ayurveda called as apabahuka. In apabahuka condition, the Grantha, the Shastra describes that the person is unable to move the shoulder joint. Okay. And then the Shastra says it is because of the Vata aggravation. Now, where do we see Vata? We don't see it anywhere. In MRI will also show Vata. What is Vata? The wind energy in the body. Is there a wind in the body? Of course there is. Do we see? We don't see. Then how do we understand it is there? From the function it does, from the qualities it has. So what are the qualities of Vata? The predominant quality of Vata is called as Ruksha. Ruksha means that which is dry and rough in nature. By example, if we're exposed to too much of aircon, what is the first symptom we see? We see that the skin is getting dry, or the hair is getting dry, the dryness feeling comes. Exposed to a chill air gives us dryness. Vata's another quality, if you see the last one, is also Shita. That means it's cold in nature. So Vata aggravation brings about dryness in the body. Khara. Khara means it's coarse in nature. And Sukshma means it's very subtle. Right? If we have the windows and some small gap also, if it is there, we must have closed the windows. The latch must have been put. But still there would be this gap, that very subtle gap. And we can feel, or even sometimes if not the feeling, we can hear the sound of the wind blowing. So in the silence of the night, you can hear the wind. So it is that subtle, which cannot be picked up by naked eyes. So now what happens in the body? Because of certain activities that we have done, certain lifestyle that we have led, certain kind of food that we have consumed, Vata is getting aggravated. It is happening on daily basis. So do we never do anything or something? No, our body will have its own strength to withstand the aggravations happening on a daily basis. And depending upon that strength, we call it as bala. And this strength is at various levels, not only just the physical level. Like we say, no, immunity. If you have immunity, you can withstand so many things. In a house, probably little dust, one person keeps on sneezing, but there are other three members in that family who don't sneeze. But one person is prone. We call them as having allergies of so many things. But it is that person's strength to withstand how he is. So this bala, the vata, when it is aggravating, the strength of us at various levels determines whether we show that symptom or we don't show that symptom. Or in other words, I can put, what is a weaker place in the body? Let's say my weaker place is the knee. Maybe I've got few extra kilos on my body, which could put some pressure on my knees. And that can be my weak spot. So if at all I'm having a hyper wind lifestyle, my weaker spot is my knee. This aggravated wind will find it convenient to go and lodge in my knee because that's a weaker spot. The bala, the strength over there is not combating the aggravated vayu. Or let's say someone's tummy is not so very strong, very sensitive tummy. The vata can go and lodge over there and create symptoms, maybe as simple as bloated stomach, that you eat little and it converts into the stomach blows up and probably the shirt button also doesn't fit after a lunch. And after a few hours, then you can again switch into, or you have to change the belt notch, one looser to fit the belt. So some people have this aggravation immediately. Some people don't have. So it depends upon how you have treated your body as a whole. It's not only one part because vata travels in whole body. Everybody has it in certain proportions. It is only a person's weak area would get attacked by it. A strong person will not get affected by it. So now in this particular case, what Ayurveda says is a person who has not taken care of the shoulder, which has now turned into a weaker side, he is going to get affected if it's not a well lubricated body. This is one aspect. Is only vata. There can be sometimes a combination of kapha also into this, where it lowers to a certain extent, that extent where the ingredients that form the joint lack the lubrication. So we can talk it in terms of vata is drying it, or probably this particular dosha. Now I introduce one more term called as kapha aspect in the body. So even if you don't remember, don't understand the word, what is kapha and all, you can conveniently forget it. But you can hold on to this particular thought, that agent which binds all our tissue together, that agent which keeps our joints well lubricated. This is called a kapha. So vata we can understand by what is causing dryness. Kapha is exactly opposite of that. What is lubricating? Vata is like very light and it is having movement. This is very heavy and it is very sluggish and slow. So only common property between a kapha and a vata is both are cold in nature. Okay? And what is hot in nature? That is pitta. So anywhere heat in the body, metabolism, digestive fire, anything that is to be anything that has to be done with the heat, that's coming from the pitta. Coming back to our topic. So now we are understanding this particular certain subtle energy, vata, that's getting aggravated. So now when we have understood that the disease is of vata and the weaker area is the shoulder joint, the ideal way we will think, okay, apply oil on the shoulder. Yes. Why? Because the oil, the unctuousness, the oiliness of the oil is exactly against vata's roughness and the coarseness. And then we warm up the oil. So that is against Vata's cold property. So there is no other substance in the world which is as slimy, sticky, oily, lubricated than oil itself. And when you warm up and apply that, that's the quickest way we can combat Vata. So does a shoulder joint person, a frozen shoulder person use only the treatment for the shoulder? No. As we see, the Vata has aggravated everywhere in the body, but went and launched itself only in the weaker place. So if we focus only locally, we will reduce Vata, but it is only temporary and only of that area. So there are chances that the recurrences can happen. Normally, shoulder joint doesn't come, the frozen shoulder doesn't get on the same joint. A shoulder joint doesn't get affected by frozen shoulder the same. The other place it can go. What do you do with this aggravated Vata of the whole body? So in Ayurveda, there is a very beautiful system of treatment called as Panchakarma. Pancha means 5. So there are 5 things where you expel out these aggravated elements in the body. I can give the term dosha, or which you have heard now, this Vata or Pitta or this Kapha, which are responsible for maintaining the health in the body. So this Kapha, the original place is chest and above. That means you have to, if you have to remove kapha out of the body, aggravated, the kapha that is disturbing, the kapha that is in imbalance, the easiest way or the nearest route is the mouth. So in one of the Panchakarma, you give the medicine orally and the person is made to vomit out. Emesis, it's called Vamana. There's another way, you give the medicine orally, it acts on the stomach and the person purges. So it's acting on the stomach where the seat of the digestive fire is. So for all pitta kind of, all fire kind of diseases are treated with this Panchakarma type called as Virechana or the purging type. Another route is you go through the anal route like an enema and bring out through all the aggravated substances through the anal route only, like an enema. So Vata's root place is pelvis, intestines, large intestine. So when you are giving oil enemas in a certain way, you are controlling the Vata at a root place. So this kind of a treatment is called as Basti. It is not for clearing the stomach alone. That, okay, I'm having constipation, so I'm taking enema. It's not that superficial thought. It is attacking the Vata, which is aggravated so much that it has gone elsewhere and attacking. In this case, it's so far from the intestine, right up over there in the shoulder. It has gone into the kapha place. It's gone over there and it's attacking. And this particular aggravated Vata, you can apply locally the oil, but the effect of the whole body is Vata to come down. A certain way of delivering oil and certain herbal decoctions. So there are many kinds of Basti or Vasti, it is called. Both are correct. It is not just as clear. The action scene is a purging as an enema action that you see. Probably the stools are not formed and you get loose stools in a certain manner. But the effect is to control the Vayu and not just giving. So this was our third treatment of Panchakarma. The fourth, I'll tell the fifth and then I'll come to the fourth. The fifth one is blood letting out. Blood let out is in various ways, like leeches, a certain way of pricking with the needle, or certain giving some striations with some instruments so that the blood can be oozed out. But we are not doing this in the frozen shoulder. I'm just mentioning what is Panchakarma. The fourth treatment, so is like putting oil in the nose in a certain way, or putting some medicinal powder, or putting some medicinal herbal fresh juice squeezed from the leaves directly, is put in the nose. And we say in Ayurveda, nose is the door for the head. All the diseases above our collarbone, the clavicle, are treated well with nasya. Anything above this is treated well with the nasya. So it is a very unique, it is something, a signature treatment, where by putting certain herbal medicines in the nose, one can treat a frozen shoulder, or giving certain oil or decoction, medicated decoction through the anal route can heal the frozen shoulder. So this is something very amazing science, where body as a whole is considered, not just a local area. Rest of the body, what is the seen, is also considered. And it is so subtle, and effect is only seen. We need something like this, because this is a Shastra Vachan, something beyond black and white, what science would see. Black and white, because Vata, where we will see in black and white, which MRI will show. MRI will show dryness, MRI will show stiffening of the capsule. So this all, the grass can be seen. So while understanding anything so subtle, we had to understand the grass aspect first, then we can travel in deeper. So where the modern says, why this capsule tightens or why it is stiffening, we don't know. But we know the effect of frozen shoulder, the tightening is the frozen shoulder. Effect of tightening the capsule is the frozen shoulder. So here comes the answer. It is because of aggressive wind in the body, which has gone and launched over there. So now we go to the second point over there, which is saying as snehana. So we have just spoken about this nasya, which is putting some medicinal stuff in the nose. It could be oil, it could be the juice, it could be some powder, and basti or vasti, some form of animal. Now we are seeing this snehana, which is the most crucial part. Snehana means oiling, oleation, where you are lubricating. So it can be done in so many ways. One of the way is applying on the whole body or on the local region, the oil. So many kinds of oil are there. One of my favorite oil in this Panchakarma, in this Abhyanga medicated oil, is something called as Prasaranyadi. And the same Prasaranyadi Kashayam is also there. It works very wonderful in these conditions. There is something treatment called as pichu. Pichu means you take a cotton sheet and you soak that in oil, and you put in a hot oil, and you put over the shoulder, soaking it in under a cotton sheath. And something called as spiritual is there, which means you take this cotton cloth, dip it in the oil, and squeeze it in a particular fashion over the shoulder. And all these three treatments, Pichu is a local for the shoulder, but Abhyanga, that means applying the oil, and Pirichal, it can be done for Sarvanga as a whole body to get faster results so that the Vata can be controlled faster. So this is an external treatment. After doing Snehana, we do Svedana. Svedana means sudation. Sudation means you apply some heat over it. So heat is applied by different ways. You either boil some herbs in, let's say, in a pressure cooker without the whistle, and where the you remove the whistle and you connect a tube over there. From the other side of the tube, the ingredients, whatever you have kept and they are boiling, they create a steam. So that is called as Nadi Sveda. Or something like you put it in a steam chamber, directly you go and sit over there. And that is also possible, Bashpa Sveda. But in Ayurveda, the steam chamber has to be in a particular way. The head has to stay out. You don't have to, for your vital indriyas, you don't have to give heat. And when you sit in also, on your heart, a wet cloth is also put. So these are like the marmasthanas we have to take care of. So our different, the Kerala specialties, the kiri, where you tie certain herbs, either you tie leaves, which are called as ela, fresh leaves, or podi, that means it's dry herbs. You tie it in a bolus. Or Nyavra. Nyavra is a one particular rice which grows in 60 days, and it is cooked with milk and certain decoctions. And it is tied in this particular bolus, and that heat is applied, or a simple salt, um, or even sand, or a lemon has been put in that bolus, tied in the cloth, and that heat is applied. And the last but not the least, something called as lepana. There are different kinds of herbs you can mix into a paste and give it as a local treatment. So lepana is a very specific, it's a local treatment. Now we go to the another aspect. So these were all the external aspects. Internally, I just mentioned about something called as prasaranyadi kashayam. But kashayams means they are herbs boiled and a decoction is, so they are not going to taste good. Neither they look good. There's no artificial color or artificial sweetener or anything added into it. It's just the herbs boiled together, and there are various. So depending upon that person's condition, why did the vata aggravate? This we will have to investigate in the consultation time. Is he, why, God only knows, how is the stomach status? Huh? Is he diabetic? Is he having somebody some other illnesses? So we'll have to analyze in so many ways. One of the ways is we call it as a dashadha pariksha. Dashadha means 10-fold of examination. I hope I'll remember the shloka. It says like Dushan desham balam kalam analam prakrutim vayaha sattvam satyam tathaharam avasthasya prithagvidha dashadha. So there are ways like what time, what is the strength, what is the digestive strength, what is the element that has gone haywire. So we have got 10 factors that we have to see. And depending on that person, so maybe you just heard from my mouth today, Prasaranyadi, you have taken notes and suddenly you start giving. It won't work like that. It would be a individual prescription for that particular person. So you really need a qualified Vaidya to analyze that. It can't be a general rule. Okay, this kashayam for this, my grandmother took this, so probably I should also take it. But your bala and the grandmother's bala, is it same? Agni bala, that means your digestive capacity, is it the same? The dhatu, that means your bone, the blood, the muscles, there are 7 such tissues in the body. Is it the same? Is the age same? Is the kala, the time same? So there are so many variable factors. I have mentioned 10 of these factors. All has to be examined. And then you come out with the kashayam, whether you want to give a Gandharva Hasta kashayam or a Dashamulya kashayam or whatever it is. There is no dearth for these medicines. It's these varieties and permutations combination. Amazing choice we have, and not one plain analgesic fitting for everybody. It couldn't be that. Is it only kashayams? No, there are so many tablets also we can use. One which comes quickly to the mind is some form of gugula, that is Comifera mukul. Very, very well known to reduce the pain, give the bone strength. Amazing. So there are so many tablets. Then there are some fermented drinks also, which taste like wine. But the moment I'm going to say alcohol in it, there will be one section, oh, then I must have some of that kind of medicine. And there would be another group, oh, this is alcohol. No, it's not. I can't take that. So let me clear this. So it's not the alcohol which you all think. This is one herb that goes, a flower that goes into a fermentation. And all the herbs, all the plant-based medicines are put into this jar. And this flower is added. That creates a fermentation, which creates this alcohol kind of effect. So what we think as alcohol, and what this medicine is completely a different thing and most misunderstood medication. Then there is something called as avarti. Avartis are oils that are concentrated and treated again and again. So you get 7 avarti, you get 51, 21. And the highest avarti you get is like 101. That means same oil is treated with that medicine again and again and again and again. And the oil, which was so much, now becomes concentrated into, and so few drops of avarti is enough to treat the patient, this oil base. Churnas are the powder forms. There are different, again, kinds of powder you can give, even to get a Agni Bala if you think. The problem is in the shoulder, but you're giving medicine for the digestive fire to be okay. So depending upon how that patient you have diagnosed, seen, and what you have found out in the consultation, it is all that Vaidya's skill. So if somebody is not getting better, we cannot say Ayurveda is not good or Ayurveda is insufficient. That Vaidya is insufficient. So if I'm not able to treat somebody, means my knowledge is not sufficient. I've not understood the Shastra correctly, because the Shastra has all the answers. It is Yojakastu Durlabhaha, means the one who applies, knows to apply what the books are saying. He is Durlabha, he is very rare person. Then there is something called as Layam, like some jams are there. Those are yummy, many of them, not some. And Ghritam, this is another thing, very important part of a treatment. The Layam and the Ghritam, these come at the end of the treatment. They are called as Rasayanas, they are called as Apunarbhava Chikitsa. That means the problem you have solved by giving Kashayam tablets and all, and it should not reoccur. Apunarbhava, not to reoccur. So the treatment ends like that orally with the ghee treatment, not the normal ghee you eat. It is, again, the ghee is treated with the certain kind of medications. And then not to forget Ayurveda. When you talk of Ayurveda, that means more than the medicine and the treatment, it is what food you eat every day. Without the knowledge of that food, one can't progress in the treatment. One needs definitely to know what to eat. I've just listed some points over here, but this would take another whole webinar to just talk about the Ayurvedic diets. Predominantly, it should be anti-vata. Now we have come to know why. Because the disease is formed by vata. Vata's quality is what? It is cold in nature. So definitely we will need only warm and cooked and hot food. We can't eat cold food. We can't drink cold water. You will aggravate that vata. You should do everything that is off. We can't have dry food. Some unctuousness has to be there. That means some ghee, some oil in that food has to be there. It can't be devoid of any unctuousness. Hydration is different than oleation and lubrication. We must keep clear about this. Dryness or drink enough water. No, dryness is not just the water. It's only hydration. Lubrication is needed. So some amount of oil person must have in the food. When I see very funny things, just yesterday or day before yesterday, I've seen a person, I have 1 spoon of virgin coconut oil in the morning. Very proudly people say like that. Don't eat like that. It won't digest. You have to use it in your cooking, mix it with the food in a smaller proportion. You don't need 1 tablespoon to have just like that. That's not, if you're working very nicely, heavy work, physical work is there, you've got a great appetite and all, you would be able to digest. But everybody using like this, it doesn't work like that. It has to be given in small proportions. So when we have to season, let's say a little bit of mustard seed or something, how much oil we use? 1 little half teaspoon, 1 teaspoon oil is. So this is all about the diet. Some tastes are there. There are 6 tastes, out of which the sweet one pacifies the vata, but a bitter one will aggravate a vata. So we should not have that. Then, of course, the cold water I have spoken of, and vegetables which we don't like bottle gourd, snake gourd, ridge gourd. Those are the healthy vegetables and not the potato, which will cause so much of vata, not those chickpeas and kidney beans, which will cause so much of vata. Something like mung beans, which will be lighter for your body. Let's go ahead. we've seen the external treatment, we have seen the internal medication, we have seen the diet. Some form of yoga one must hold on to. If you don't know how, you have never learned, please look out for a good yoga teacher to get some poses, so that it's not when you see them doing, you feel, oh, they have flexibility. I am now 50-year-old. How do I get this? Some movements under some training, you will be able to do. Otherwise, of course, physiotherapy is the best way, and you should learn how to move or how to do certain exercises. I'm showing just few of the exercises over here, where you move with a support. Like the first one, you see the rolling, how it is done. In the picture below, how a weight is held and like a pendulum, it is rotated. All these various kinds, various forms of exercise, it's good to do under a guidance. First learn, otherwise you will damage and you will hurt yourself. But without exercising, it is going to be very difficult to come out of it. So just make sure there is a movement done. Don't immobilize your joint. That's why I've put, because if you immobilize it, it's going to get more stiffer. And best way is to apply the oil, do the heat therapy, give more blood circulation and lubrication over there, and then go for your exercise. That's the best option that one can do. Then I'm just going to touch a point which is only for information we should see. One of the part of Ayurveda, because it won't complete, I won't give you. So I'm just going to mention there are some vital points in the body. I've just shown one of the marma in the yellow spot, but it begins from the hand. So we have Shipra marma over here in the hand, also in the leg, in the similar place we have. So from the entire hand, these marmas I have listed over here, which one needs to work on that, stimulate the marma to release the frozen shoulder. And last but not the least, we should not mistake injury to a rotator cuff muscle as a frozen shoulder. Both are completely different. One is this capsule that covers the shoulder joint is having an issue, and rotator cuff muscle issue is completely a different issue, not a part of a frozen shoulder. Not so the muscle that are supporting that arm to move is having a problem. So with this, I think I should stop over here. We'll take the questions. I'm seeing a lot of questions coming in. Let me try to. Okay, one question is for the webinars. So go on YouTube and you will just type in, search for Nuffield Academy, and you will get all the webinars over there, not just mine. Whatever Nuffield is conducting, Nuffield Academy is conducting, or from various, from dental, from so many aspects are there that you can see. So mine is also one among that. Then, okay, so that part is answered. Okay, let's go ahead. Is frozen shoulder a serious problem? No, it's not a serious problem in a sense that it is incurable, not in that sense. But it is a serious problem for the person who suffers it. Just imagine that you can't scratch your back. Just imagine you can't reach out a book. Or just imagine your daily chores. Above this, you can't. So if you're just wearing a shirt, it's going to be a problematic. You can't get that movement. So in that sense, it is a serious problem. So you cannot neglect it. You will have to do something about it. You can't allow it to just stiffen, because you keep on preserving it one day to get better on its own. If too much stiffened vata, there is a limitation of that then to do only with the oil. Then we'll have to go to the modern only to get a surgery or some jab or something. So in that sense, it is a serious. But good part is there is a solution for it. Okay. What foods should you avoid with frozen shoulder? I think, yes, I have answered that. What vitamins are good for us? They're asking a wrong person because I am against this vitamin market. Um, have a good diet. Don't pop in a pill. That would be, we are feeding and making all these pharmaceutical companies very rich. So we are under the blind, this certain advertised comes, they market it so well. Their models are so good. The colors they use are so good. And you really feel that in life you are somewhere behind and you must catch up on that. So it's like a more consumer market. Let's not have this habit of simply consuming a vitamin. There should be some deficiency, some reason, something, and you have taken it for a while, overcome that and then you have to drop it also. I see people, they keep on taking it. So that's not good. Is heat good for frozen shoulder? Yes, I think I have answered that. The number of kiddies that I have shown, we have to, yes, apply heat over there. Can frozen shoulder lead to paralysis? Paralysis can have a frozen shoulder. So you can't move the shoulder joint and all. See, both are different. This is a local issue. What? The frozen shoulder. And where is paralysis happening? There is something happening in the brain where the arteries, they have lost their elasticity and they have probably broken. Which side of that thing is happening, that event? Opposite side of the body getting affected. So both are completely different. Then comes, can frozen shoulder be a symptom of something else? No, it's not symptom of something else. But as I said, it is that capsule in the modern angle. But in Ayurveda, it is definitely the vata that is getting aggravated. And diabetic frozen shoulder is common. So we have to see whether the person is having his sugar under control or not. What is the best way to sleep with the frozen shoulder? Oh, it can't be something common. It depends on that person because it's a very miserable night that person suffers from. So it is nothing best way, whatever one feels comfortable. Not all people can sleep straight. They need to change sides. Probably their chest or their breathing is not so very comfortable, and sideways is a comfortable, neither way. So a person will have to find the own way, whether you want to put pillow, support of a soft cloth and then go on it. So it is going to be a individual convenience. Thank you for another. As of 40 years, it is recommended to follow Panchakarma once a year as a preventive measure, or should it be done only when certain malign conditions manifest? So whether Panchakarma has to be done simply. If so, what is the best season to benefit from nature's support? Thank you. Very brilliant question. Panchakarma has to be done simply according to Ayurveda and not wait till the disease gets formed. So there is something called as Vasantik Vaman. Vasantik Vaman means emesis, doing Vamana karma, giving medicine and vomiting out the kapha. So Vasanta means spring season. What happens in a winter season? All chillness is there. Okay. Spring comes after the winter. In spring, what happens? The sun shines brighter. All the darkness and the gray and all that deep winter has gone. So the cold that was trapped, with the heat, it melts. So by nature, in the spring season, all kapha type of problems come. See, I can say it in the other way. All the allergies come in spring season, sneezing and whatnot. So for a kapha to reduce, you can have a Vasantik Vaman and you will not have any allergies. This is one part. In the summer is accumulating a lot of heat. And after summer comes the rainy season. So what happens over there? The heat and this rain this combination is giving, we call as pitta, this vata aggravating factor. The heat is subsiding and the rain is creating an issue with the chillness. So Basti is good in the rainy seasons. Basti enemas. The oil enemas are not soap water enemas. Definitely no soap water. It dries the intestine. Enemas are not those coffee enemas. It is not for clearing the stomach. I'm talking of Basti, the enemas of medicated oils and medicated decoction to reduce the vata. Rain has come and gone, chillness is there, then comes the autumn, the time for pitta to get aggravated. So we should have some purging done at that time. So Vamana, Basti, where the vata is aggravating, you see the vata example in rainy season I can give. All these arthritis people, they get aggravation of pain in their joints very badly. All this happens in the rainy season because vata gets aggravated with the rain's chillness and the amla dharma music. So many factors are there, but I've just said very in a colloquial language. So in three times at least we have this to do. And do we have to do all three in the all year? Depending upon your body's condition. If you have the bala, please go ahead. If you don't have the bala, no. Then it's not the shodhana karma. Shodhana means to get out of the body the aggravated doshas. Then you can go for something shamana. That means you pacify the aggravated doshas within the body. Then in the dinacharya, that means daily, this I said about the rutucharya, that means the season, according to the season, what you have to do with the panchakarma. But in the dinacharya, one of the therapy that is said is putting oil in the nose. So the nasya in the panchakarma is to bring out all the aggravated, but the nasya in the dinacharya is to prevent all the problems that to come all about the clavicle bone. So yes, you can put 1 or 2 drops of sesame oil in the nose. And Rakta Moksha, it is not simply done. There has to be some reason why you would need a Rakta Moksha. I think I have answered that. Next question is, as Vata is about dryness and applying oil on the body helps, are there some medicated oils, ghees, which can be taken internally to ease the Vata? Yes. So many of them. Like this is the Ayurveda forte. And this should be a person to person different. And if you don't have any access to Ayurveda doctor, then for your cooking, the coconut oil would be a better if you're not living in a cold country and it's not a winter season. And on the body to apply would be sesame oil. Internally, little bit of ghee would be okay. So to make your daily food with little bit of oil or ghee, that should be okay. Medicated ones, there are so many. If I start telling names, I'm sure you all will start jotting it down, and that's going to create a problem because I do not know who is of which prakriti over here. So that's a problem. Then thank you, Dr. Varsha, for excellent informative session. How can we get a copy of presentation as PDF recording for our reference? Okay, so you can contact the academy person. I can leave the PDF of the stock, and I don't mind sharing this at all. It is meant for giving only. I don't sit and preserve anything as my thing. It's not there. And if you are living in Singapore, do visit me. This is my address. You can just give a call. You can note this, and we can have you see directly and get also. So I would also like to see, but yes, you can contact the academy. I can leave the PDF files over there of whichever talks you want, and it will be shared freely. No doubt about it. I think I have taken all the questions. Is there anything else that I have not answered? Ali, have you spotted out any question which I have left?
Doctor, all are answered.
So if you have seen the address, I'm just stopping. Yeah. So thank you for joining. And as always, we end the session with a prayer. In my last Thursday session, I had missed it, so I chanted it on my own later, just with a prayer so that everybody stays healthy, happy, and disease-free, stress-free. Are there any questions coming in? Am I ready to end the session?
Yes, doctor. All good.
Okay, thank you. Om Sarve Bhavantu Sukhinah. May all be happy. Sarve Santu Niramayaha. May all be disease free. Sarve Bhadrani Pashyantu. May everybody see only auspiciousness everywhere. Ma kaschid dukkha bhag bhave. Let there be nobody in suffering. Nobody should have pain. Om Shanti Shanti Shanti. Let there be peace within me, around me, and in the universe. Thank you all of you for joining this series. I'll come back in February month with new topics. Y'all are requested to send the topics that you would like to hear so that I can prepare it and deliver what you would like to. Many of you are sending, and I'm grateful for that. I'll start preparing, and we see back in February. Thank you. Thank you so very much.
Thank you, everybody.